Hi, I'm Dr. Pajari for the Prognosis podcast, and we are here today for an episode to wrap up season 1 entitled The Hospice Experience. I have the Hilton family with me today, and I'm going to go just around and introduce. First and foremost, I have Cathy Hilton here today, a corporate lawyer, and here to speak about her own experiences dealing with hospice for her husband. Welcome.
Thank you.
I have Sheena Hilton, a soon-to-be lawyer at Stanford, here also to speak about the experiences that she encountered for her dad with hospice. Welcome.
Thank you.
And I have Sean, who is an actuary, and he's also here to speak about his experiences with his dad on hospice. Welcome.
Thank you.
So just getting started with the conversation, and I know this is going to be delving into a lot of, difficult but really important and poignant things about the hospice experience. Tell me first and foremost who Larry, your husband, was, who he was as a person, as an individual. Just give a kind of an idea.
Wow, it's
a lot.
It's a lot. We were married for almost 37 years.
Mm-hmm.
And he was very decisive. He was very active. Enjoyed his passions were golf and gardening. He liked to be, very social. He knew everybody in the neighborhood. He was also, he was a teacher. He's a speech pathologist. Mm-hmm. And so he was, it was also very interesting to meet some of the kids that he interacted with, to see the reaction to him. But in addition, of course, he was a husband and he was a great father. Mm-hmm. So he just had a lot of passion for family. That was really, really important to him, and just was so supportive of not only me, but also our children.
Mm-hmm. Sheena, tell me what your impressions of your dad were, who he was or who he is in your mind as a person.
He was definitely a doer. As my mom was saying, he actually, in his earlier years, he wrote some poetry, and there's one about doers and talkers, and he definitely put a premium on being a doer over a talker. So, but like she was saying, he was a great dad. I mean, he would very, very supportive. The first thing that came to my mind when she said that was once I sent them a picture, this silly picture. I was wearing a blonde wig, and it was just a joke. But he thought it was real that I had changed my hair, and so my mom was horrified. And he said, "Don't be mad at Sheena. That looks great. You need to really support her. That's what she wants to do." So yes, he's just very caring, very supportive, and tried to, education was important. Sports, he loved his sports and tried to get us all to play golf. I think Sean and my mom were more successful at that than I was. But yeah, he was an all-around great dad.
That's beautiful. He sounds like just a really lovely person. Sean, what were your memories or impressions, or what do you have in your mind when you think of your dad?
Yeah, I guess what comes immediately to mind is that he put his heart into everything that he did. I don't think there was anything that he did that was half-hearted or medium effort in any respect. It was, if he was doing something, it was going to be with all of his motivation and effort. As a dad, as a golfer, a card player, a driver on the roads. He was always speeding. Well, anyway, he just put a lot of effort into everything that he did, and it showed in the life that he lived. Yeah.
Yeah, and you know, it's interesting what you said about writing poetry or being a speech pathologist and working with people who had difficulties, because that's a tender side, you know, to someone. So was there that tenderness also, that softer side, or?
Yeah, for sure. I would say he didn't express that as much verbally as he definitely showed it, not non-verbally. And that was something that I remarked seeing towards the end of his life too. The kind of whatever barrier that might have existed in terms of expressing himself, emoting some of those softer emotions, definitely that barrier was not there towards the end, and it was kind of beautiful to be able to see, him have that full range of expression, at least as I saw it. So, yeah.
And I think his granddaughter, our niece, really brought that out of. I mean, he was most definitely a doting grandfather, and would rock her to sleep and did it. So we definitely saw. Her name is Lydia. When Lydia was born, we definitely saw his softer side for sure.
Mm-hmm. That the grandkids bring it out.
But it was also interesting. He did have. He had this soft side to him when, he would literally give somebody the shirt off his back. So, if somebody liked something that he had, he'd say, "Here, you can have it," and it was always so. He was just very generous, and it was very touching to see that. So he loved golf, and if somebody said they wanted to play golf, he'd say, "Oh, I'll be there to help you. I'll teach you." He mowed people's grass or washed your car. He just really had that really giving side.
A very kind spirit.
Yeah, very kind.
Well, the difficult thing and the reason we're here today is to talk about that trajectory of such a wonderful person, and then what happened afterwards, which is a very complacent thing, but at the same time a very individual process for each of us. So tell me about when he first was diagnosed. So he was given a diagnosis. Tell me about that.
Well, I always remember it was June of 2017. And he, just the weekend before, it was June 5th, I think was the date. It was a Monday. But the weekend before, it was just something seemed off, in terms of being forgetful. He just couldn't remember the code, the alarm to get in the house. It was just, it's very disconcerting. And then that Monday, when I came home from work, he was saying that, he was at the doctor's office. He couldn't remember his name and address. And so I was concerned, and I didn't know, what was happening, if it were possibly a stroke. I just had no idea. And we decided to go over to the emergency room. And so, we told them, what was going on. And they, based upon that, they did a CAT scan. And the doctor came in and said that there was a mass in his brain. And so they didn't know, obviously, they didn't know the diagnosis at that time. But he was hospitalized, and we quickly learned that it was glioblastoma, which is a terminal cancer. So it was all in a week time, just to kind of have your world turned upside down. Yeah.
What? Well, a few questions come to mind, but what was his initial reaction to that?
I think it was really very hard for him to accept. He seemed to kind of not kind of, it was well, do you see it? Do you, and so he just didn't, I think he just didn't know. It was such a shock to him. He felt like he took very good care of himself, and he was very active, and just so it was really, I think, just a hard thing, and he did not like to be, being hospitalized, not being able to get about and do the things that he liked to do. I think it was hard for him to kind of face that he was in that position.
You just reminded me of something that's actually probably a pretty big point. I just wanted to mention it, is the idea that, sometimes when we're in shock from these things, we think, oh, well, I took good care of myself. I was always healthy. I didn't smoke, or I didn't do this. It's almost like an affront.
Yes.
And you say, well, how could you do this to me, God, when I really committed to taking care of myself? Do you feel like there was a little bit of that there, or maybe not?
I think he did feel somewhat betrayed in the fact that he had taken good care of himself, that he couldn't understand, how from that perspective. But he was also, kind of like what Sean said, he would get very introspective. So it would be very, very difficult for him to verbalize. So he would, it was definitely a challenge, and it impacted his speech. And so the tumor was in a place that impacted his speech. And that was very, very difficult because he was a speech pathologist. He spoke for a living. He was a poet. He was a big talker. That was huge. If he was doing the family prayer or something, he would go on, and he was very verbose.
Yeah.
So it was very difficult when he was having trouble because it impacted his memory. He would have the words, but it was hard for him to articulate things.
Yeah, sometimes, not to digress, but sometimes what you just brought up was pretty powerful, because we get illnesses, but it's not, you have to step away, or one has to step away from the concept that it's a punishment, or, you're receiving something and you ask, why am I receiving this? And that can be very difficult to process. And on top of that, it can have meanings. As you said, he's a speech pathologist.
Yes, right.
To lose the very thing that he was so aware of, and he was so instrumental in guiding others on how to speak, and then to lose that, I think it's so poignant and painful.
Yes.
So I can imagine that was very tough. He was in the hospital and probably struggling, and I can imagine also cognitively trying to process this when you already are not thinking clearly, but trying to kind of wrap your head around it is tough. What happened then? So walk me through a little bit of the initial stage. You probably had surgery.
He actually decided, well, along with the doctor, so his initial doctor was uncomfortable operating on the tumor, which is normally the treatment. They would try to remove it. But because of its location, she was very concerned that she said that she had seen patients, the surgery go badly, where they would just totally lose their ability to communicate. She decided that and he agreed that he didn't want to have the surgery. So we did, interestingly enough, Sean and I were going to take him down to see, a specialist that could remove it. And he decided, we went down there, but he refused to go in. So we were in the mode where he was going to get radiation, and that was how they just decided to try to shrink the tumor. And there were challenges because of the medication, the various medications that were the side effects from that. He became diabetic, and so we were, dealing with that. And
that's correct. I remember with the dexamethasone.
Yes,
so yeah, he had
it
issues.
Progressed significantly, and even the steroids that he was on, they caused. He was having really strong, reactions to them. So they were trying to taper him off. For whatever reason, the steroids just had a really tough. They were really tough on him. So, and he was, you can imagine this doer that we talked about. So he's not supposed to do anything. So the challenge was immediately when he came home from the hospital, he's outside in the yard, with power tools, and, I'm horrified, that his thing was, to push his body, probably when he should not have. But that's what he did for a long time.
That's a common one too, I think, where, it's common, where you want to just move forward as you always have.
Right.
And there are limitations. And really struggling to accept it or being forced to accept it. I think that's pretty tough.
Yes.
Did you have, what other things happened during that time? So he came home. Well, how was he doing at that period in time at that point?
It was a tough, Sheena was there because it was in the summer. So we were trying to get adjusted to what this new normal was going to be, going to his appointments. So she actually took him to his radiation appointments. I eventually went back to work, and it was just trying to kind of get things stabilized, how we were going to be moving forward. And he had only been given about 6 months to live. They didn't expect him to live until the end of the year. So we didn't know like what kind of like what we were planning for, what we were facing. So it was really a very confusing time, and just trying to get things stabilized. We considered bringing in someone to the home to help him, and he absolutely rejected that. I mean, he just
No.
Yeah. So it was a challenge. Fortunately, Sheena was able to stay until August, and then he said he would take care of himself, which he did, and eventually started to drive and play golf. So things did improve.
They stabilized out a little bit with the treatment and the regimen he was on. Sheena, you were going to say something just then about that period of time, and I wouldn't mind hearing also what Sean thought, but yeah, what were your impressions at that time for your dad?
So that summer was very just focused on medical care. I mean, we went 5 days a week to his radiation treatment, and sometimes he would have an additional appointment after that. So once I had gotten home from work, since I was a teacher, had the summers off, we were going to the radiation place every day, and we were kind of a rough-looking pair because I had torn my meniscus at the end of May, so I had a huge leg brace on my leg, and probably shouldn't have been driving, but he couldn't drive, so we would show up at the place, and I would have my crutches and the brace, and he was not looking so great either. The people were really nice, and I think they probably felt bad for us, but I think he probably rallied because, like my mom said, he did not want to have somebody in the house. And so the summer, it really was challenging with the radiation, and then he couldn't do his check his blood sugar himself, so he had to have his blood sugar checked 3 times a day, so one of us would have to do that. But by the time I needed to go back to school, he was able to be self-sufficient enough so that he didn't have to have anybody in the house with him during the day. And then it really was, he had some ups and downs over the ensuing 3.5 years or so. But to me, that first summer was the worst time. Outside of once he entered home hospice, so January, then his functioning started to decline. But that first summer, that was when his health was the most challenging, and also his recall and mental functioning. I'll never forget. I was taking him to a cardiologist appointment, and I saw he had a pad of paper there, and he was studying it on the way. And so I looked over. I was driving, but we're at a red light, so I look over, and it's his name and address and birthday, and he was trying to make sure he could remember it so that he could sign himself in at the doctor's office, so I didn't have to do it for him.
Oh, wow, that's very touching to hear that he was doing that. Yeah. So, okay, the first, that summer right after the diagnosis was really rough and things stabilized. Sean, what were your impressions of that time?
Yeah, I remember just getting used to what his capacities were after, learning the diagnosis, getting a sense of what his, speech capabilities and ability to read, those types of things. But then once we kind of had that understanding, it did feel like a new normal. I didn't live in the area. I only, came down here more permanently this January. So most of my experiences were from long distance. And over the course of that 3.5 years, I think it just kind of weighed on him. My experience of his disease was like how much it weighed on him speaking, how many times he would like apologize for his inability to recall. It definitely showed, but he always gave the effort to push past those difficulties in speaking. And that was, and we tried to give him as much as encouragement, that it wasn't an issue. That was just good to, for him to express himself how he could.
You know what you were saying about his